Morning. Welcome to a wonderful session on Sunday. Now, in fact, this program normally will take 2 weeks, about 1 week for physio and 1 week for pharmaco. And what I'm doing today actually is a 4-day work, compressed in one. So to be realistic, I wouldn't be going through everything. What I do is that tell you what are important things and what to read, what the examiner wants from you, how to answer vivas, MCQ, and essays. So I think that's more important. I think more focus on what we call it, exam techniques. Maybe you should sit there. Now I don't have to turn my head. Now, if you look at pharmacokinetics, if you are weak in pharmacokinetics, you are finished. You are finished. Because most of the questions will be pharmacokinetics. Somehow will be related, even in the viva. The first thing is always pharmacokinetics. Cannot escape from that. Trying to make this work. Okay. Now, you see, pharmacokinetics, just remember, it's ADME. Any question that they ask you, discuss factors of what drug, narcotics, whatever, how does it affect? Always start with pharmacokinetics and pharmacodynamics. Tell me something about morphine. Tell me something about morphine. If you can actually discuss it about pharmaceutical, pharmacokinetic, pharmacodynamic, you start like that. So it's very important. Now let's move to something, okay, bioavailability. Bioavailability is a starting question in viva. It is always a starting, because most of the time when you go for viva, we prep you up. Now, it is the question where you walk into the exam hall, if you survive your theory, they like to make you feel comfortable. They say, okay, tell me something about bioavailability. Can you imagine you cannot answer? So you can answer, you're finished. So you must have at least be able to open your mouth a bit. Say, mini that. So you just remember this diagram. The ratio of the definitely bioavailability is a ratio of area under the curve. Identical, all these rate. Bolus, oral versus IV. So when we talk about bioavailability, if it's IV, it's 100%. So is this the beginning? So if like that, I give the slides, I don't have to come here. Correct? So you must, in exam, you must like main jatuh, play chess. So you play chess. So that means when you examine down about bioavailability, you must think what is next question. You have to know. Right? So that means those who are not coached, they read this in isolation and they don't know what is happening, so they just memorize that. But if you're smart, you have been coached for exam, the moment he starts talking about bioavailability, you must know what is coming in question 2, 3, 4, the examiner's mind. So to pass, you must enter the examiner's mind. Okay, what do you think is going to come after next bioavailability? So in bioavailability, the next question, let's say we talk about oral drugs. The next question come up, what do you think? What do you think will come out next? What do you think? When you sit there, man, you cannot be just bioavailability. What do you think? Anybody volunteer? Hey, must play chess. It's going to be first pass. Tell me about first pass. Then tell you correct. So you say bioavailability of this drug, this or this. If it's IV, is 100%. So if it's not IV, sure something happens, it's less, correct or not? So somebody has makan it. The one that makan is from the liver mainly and also a bit on the guts. So they're going to ask you, tell me something about first pass. After first pass, what do you think they're going to ask you? After this, you'll be expert. After this, what will happen after first pass? Extraction ratio. They are going to ask you on extraction ratio. And after extraction ratio, what are you going to ask about extraction ratio? Guarantee. It's a sequence one. Capacity limited, flow limited, and give examples. After that, what are you going to ask? What do you think? Examples of zero order, first order. Then they want you to tell them all about the classic zero order drugs. Now you understand already or not? So this will make your life easier. In these 5 minutes, we communicate. That is what you should know. It's called a professional student. A professional student who sit for examination. Can you imagine somebody who just go there and tell you about bioavailability, just memorize and then you're finished. You're only one step. So but the professional student, when you see the word bioavailability, what do you think you should do when you hear the word bioavailability now? Exam. What is the first reaction now? Tell me something about bioavailability. What is the first reaction? The first reaction, girl, is to laugh. You know why not? Because you know the sequence already. Correct? Betul or not? It's a game. It's a chess game. So that means if you ask you bioavailability, you should start laughing. So that means the smartest person in Bio will speak non-stop. Never give the chance to the examiner to ask questions. So if you're a professional student, you say, oh, bioavailability is this. IV 100%. Other drugs orally may be less than 100% because some of the drugs are taken by the liver, some minimum just to impress upon them. The gut also do that. Because of that, it's something called first pass effect. First pass effect means one single loop, not many loop, no. First pass, one loop from the gut to the liver out. Compare this after that. And then because of this, you have two types of removal of the drugs by the first pass. It's the capacity limited, flow limited. Then because of this, you get this. Then the first order, zero order. Can I give example? You know what the example will do or not? Look at you. Pass for that, finish. You understand or not? You understand what I'm trying to say or not? You want to pass, you must take hold of the situation. Think about it and see. Correct? So one day you become an examiner. You got a student come out, tell me about bioavailability, and the floor has wall up all the questions that you wanted to ask. You understand? Wall up all the questions that you wanted to ask without you asking. So we see. And it's true, no, because some of the students are so well prepared that sometimes when I examine, actually been examining for some time already, we run out of questions. When we run out of questions, distinction. Distinction. Now, factors affecting bioavailability. If we ask you, very unlikely, unlikely, because Bible is very short. We don't go into too detail. We want to see your general trend of thoughts. Factors affecting usual. This is an important one. I brought it up because you must always, anybody ask you factors about anything in anesthesia, anything. Factors affecting why are you, even now, why are you sleepy? You say patient factor, drug factor. Everything you start with patient factor, drug factor. Patient factor is you classify as physiological and pathological. Physiological easy age, sex, body habitat. And then pathology, you can just say something Then drug factor, pharmaceutical, pharmacokinetic, ADME, pharmacodynamics. This is settled already. Everything is the same. Yeah, smart. Okay, we don't have to waste time. So you read, all this together. So when you read, now this one just to remember MCQ, numbers. When you read. Now, lung. So sometimes the examiner asks this question, do you have any other place where first pass effect occur? Definitely the lung. Because we also use a lot of ventilation agent. Plus also some of the drugs somehow trapped in the lung. Okay, now, this is a very important slide. I think it came out in your last 2 years ago exam, or 2 exam before that. All the drugs that are absorbed, let's say from the gut, the skin, gut, the skin. When I talk about bioavailability, they like to ask you on skin, transdermal. So the gut, placenta. I think there was a question recently, placenta. Oh, you never look at the past question, Sure or not? Recently, the placenta transfer of drugs. So when you, and then there was 1 year, I think recently 2 years, I was a bit stunned, Same question asked, but different way. Let's say we talk about transdermal and placenta, ask how does drug transfer across. Any drug transfer across, you must remember Fick's principle. Fick's principle. So the question in the recently think about two exam ago, go back and check and see. It's Fick's principle. Don't look down on this simple thing. So they ask you how does drug transfer across the placenta. Then it's a Fick's principle. Otherwise, right or not, placenta is Fick's principle. Then skin also Fick's principle. Everything is Fick's principle. I won't like to go into too much detail. Otherwise, because just pharmacokinetic dynamic normally take half a day. Unless you, but if you got any question here, you better ask. You raise your hand. See, you're here not to, because I gave you all the slides. You're here to solve your own problem. You've got many things in your mind. Correct? You solve it. And I always say when I come here, the person who pass will be the one with the thicker skin. Your thick skin will pass. Thin skin cannot pass. If I'm not, and we're not here to make fun of anybody, I'm trying to now you open up, open up. So you don't have to fear. The thick skin will pass. Thin skin, you're not going to pass. The thick skin fella, every time I ask any question, up. I've actually taught a little while in Australia also before. Wow, those fellas, when I ask a question, all the hands up. Malaysia a bit shy. Trying to convert you to them. Very intelligent. They're very highly intelligent. In certain ways. They put up the hand. So they have to answer the question. Then someone asks, ask. In the end of the day, finish, you go to the pub. The revision completed. You found not? Malaysian, diam. Then they go back and study. Betul or not? So the Australian, they were, I know, they know. They just want me to talk. So they are revising. You understand? Brilliant or not? So not that they're intelligent, they're very smart in making use of me. They're smart in making use of the lecture. So you must do that. So I offer you, if you've got any problem, up the hand, solve it. Because this exam, there's no quota. Pass, all can pass. Fail, all can fail. There's no quota. Remember that. So remember, Fick's principle. Now see, I just want to show you, see. They ask you, what are the factors that affect oral? What are the factors that affect transdermal? Factors that affect rectal, placenta, anything it is, drug factor, patient factor, drug factor. It's not physical chemical can put your drug. So it's always drug factor, because otherwise you don't know what to write in essay. Essay, 20 minutes each. 20 minutes each. If you're not organized, you'll be just talking about absorption. Now you remember when you write essay, you got 20 minutes each. You're actually more looking at the headings. So one heading, write 1 or 2 sentences. One heading, 2 sentences. Imagine you got one heading, and then nothing there. Just write on ADME, just write A and D. Wow, mati lah. Whatever you write one textbook also 50 marks. But you write ADME little bit, 2 marks. If I'm not. So that means actually you don't need to know a lot of knowledge. You need to be smart. No need to go too much in depth. Heading a few. Okay lah. So you can read lah. I think you can read. Now, you have got the slides. Empty. Let me know lah. Now, I just underline this red one. Ionization. Remember, ionization fundamentals. What drug can pass through membrane? Basic things they will ask you. What drug can easy to pass through a membrane? What drug it is? What do you think? Lipid soluble, small size. Lipid soluble, small size. Unionized. So and all this also go back to Fick's principle also. So the ionization these are things that I put here because they would like to ask in exam. Why? So it means like that. If the drug pKa of drug will be acid or base, if it's very far, very down from the pH of the tissue we are talking about, very far, it means it's going to be highly polar. Unlikely they will cross. If it's pH, acid base, very near the pH that of the tissue we're talking about, normally 7.4, then it is tend to be unionized. So it means the further the pKa from the tissue pH 7.4 is going to be polar. So therefore, your acid drugs are better absorbed in low pH environment. MCQ. You don't have to memorize. Basic drugs are better absorbed in basic environment. Yeah, that means, for example, you got aspirin. Aspirin is acidic. So therefore, it will get highly absorbed in the stomach, but not in the small intestine. Understand? So the converse is true. See, concentration, solubility, area. See, what does this tell you? 1, 2, 3, 4. What is this? Fick's principle. Really not. So that's why the question that came out recently for the placenta transfer, panic. You see student, you see the paper, the eyeball also drop onto the paper already. It's the same thing, correct or not? The pressure gradient, that means the concentration gradient between the blood and the placenta. Then you can talk about polar, not polar, ionization, polar excitation. Wow, if you have kept the cool, probably pass already. You understand or not? Keep your cool, rectal, anything. Rectal normally you don't ask. Normally if you ask, you talk about drugs, it's just IV, nothing much to talk about. But already it's 100%. It's always for discussion's sake, understanding the topic is oral and transdermal. Oral and transdermal. Just put factors or factor transdermal. Same thing same thing. See? Same thing. I have many times already. Placenta pun sama. Gives an example. Always gives an example. So when you write a drug, when you write an essay, patient factor, physiological, pathological, drug factor, pharmaceutical, pharmacokinetic, pharmacodynamic, right? Then later at the end, you can put there some clinical score mark. It's called scoring mark because we want distinction. Go for clinical use of the drug and give some examples. This one, they always ask. This one, at least you know something, Ampang, GTN, cancer pain drugs. This one, I just put there. What is this? What is this? This is for distinction student. It's for distinction student. So if you want to answer, just tell the examiner, I'm not too keen. I put makan already. Okay. Advantages, disadvantages.